Good afternoon and welcome everyone. I'm Sandra Fortner. I'm the Assistant Library Director here with the Floyd County Library. And I would just like to say thank you and welcome along with our Black History Committee. We're so excited that you folks have decided to join us today and help us celebrate Black history. Today, we're going to discuss ways to take charge of our health and well-being as we navigate through 2021 and well beyond this year. Although our programming has been virtual during COVID, we want you guys to know that our doors are physically open. We're here throughout the week, and we would love to see you. If you have a few minutes to stop by and you want to just maybe check out some books, maybe browse our collection, stop and read a little bit or use some of our computers, we'd be happy to see you. And we still offer curbside service. So if you don't feel like getting out of your car, or if there's snow outside, give us a call and we'll run your materials out to you. Also, we want to let you know that our other locations are open as well. Our Carnegie Center for Art and History, which is located right up the street at 201 East Spring Street. They're currently open and they offer some permanent exhibits that some of you may be very interested in taking a look at. They have a permanent exhibit entitled Ordinary People, Extraordinary Courage, Men and Women of the Underground Railroad. And they also have some rotating exhibits throughout the year. So feel free to stop in and take a look. I'm sure you'll be very well pleased and surprised. Our third location, which is our Galena Digital branch, which is in Floyd Knobs, 6954 Highway 150, is currently temporarily closed due to COVID, but they are offering curbside service throughout the week. So they'd be happy to see you as well and be happy to bring some things out to your vehicles. So just wanted to share a little bit about that with you guys, and you can always find out about any of our ongoing events by visiting our website or giving us a call, and we'll put our contact information in the chat box for folks to see. But let's move along here. So before we get started, I just want to give a few housekeeping rules to folks. Please make sure that everyone's mic is muted. And if you have any questions at all, please feel free to type those questions in our chat box. And Michelle will do her very best to answer those questions for you at the end of this presentation. And then last but not least, one lucky guest today is going to be the winner of their own very wrist blood pressure monitor cup. So we will contact that winner after the program and let you know how you can pick up your prize. So let's move a little bit forward with Michele. We're happy that Michele is joining us today. So I'll share with you a little bit about Michele Harbin. Michele is a registered nurse with more than 33 years of experience in surgical nursing, prevention, and wellness. She has been featured for her work with the Kentucky Heart Disease and Stroke Prevention Task Force, Cardiovascular Assessment, Risk Reduction, and Education Collaborative, a statewide initiative to raise awareness about blood pressure numbers and management. Michele is a board-certified operating room registered nurse, member of the Health Ministries Association, and member of the Holistic Nurses Association. She is a former member of the Metro Louisville Board of Health and a former adjunct instructor of Spesserian College, American National University, and Bellarmine University Office of Continuing and Professional Studies. Michele is also an active member of her faith community, and she serves as a member of the health ministry team there. And so once again, we are so delighted to have Michele join us and share with us today how we can take better care of our health as we move into 2021. So without further ado, I'm going to turn it over to Michele.
Thank you, Sandra. It is a pleasure to be here. And even though we can't be in person, we're taking advantage of this virtual opportunity. So thank you. And I thank the Floyd County Library and the staff for having us share today. I want to have one disclaimer. You heard my history of my experience. Today, I'm sharing no medical advice. It is information that we can share and adopt, and suggestions on how we can have, from my professional and personal experiences, so where we can take more charge of our well-being and our health in partnership with our healthcare providers. So just wanted to put that disclaimer out there. I want to stay within my scope, but I have many things to share with you, and looking forward to us having interaction. So take a moment, think about, how busy are you? How busy are we? We have full days, full nights. We juggle several roles. We have to-do lists, must-do lists. We are given deadlines. We make deadlines. We meet deadlines. We care for our families and loved ones. We care for our pets. We maintain our households. We make sure that we meet our personal commitments. That is just exhausting. So whatever time we have left, is probably, we come at the end of those lists, the end of those things that we have to do. So maybe, just maybe, we take a moment, a period of time where we just squeeze in just a little bit of time for ourselves to where it makes us feel better. Maybe if we're lucky. But what do? Every single day, we push through. We find the energy, we find the motivation to get through today, to get through those deadlines, to make it through those deadlines. But let's just take a moment. So just take a moment with me. We probably have had quite a few things happening to get us to this point right here, to make this opportunity to attend this virtual opportunity. Take a moment. Take a few deep breaths. So just take a moment. Take a few deep breaths. Now appreciate yourself. Appreciate yourself for all that you have accomplished, whether that be today, whether it be the past crazy year that we've had, challenging year that we've had. Think of the positive, have positive thoughts. So for the next few minutes, focus on those positive thoughts. Focus on those things that you have accomplished and you have come through. Think about it. Those accomplishments, that pushing through, that is your power. That's your power that's within you. So just take a moment and celebrate that. We often have times where we look at the things that we haven't accomplished, the ways that we fell short. But we all have the power, that energy inside of us to push through. So I'm going to give you just a few tips, what I call power tips, to help us, because we want to know the power is within ourselves to take charge of our health. Again, my personal experiences, I want to share just over time of what I've experienced in hopes to help someone else. I may hit on something that you already knew, which is great, but I hope that maybe I've covered something that you didn't think about or that you didn't consider before, which would be powerful also. So I just hope that you have something that you take away. So, power tips. Power tip number 1, partner with your healthcare provider. Think about your opportunity that you have and are blessed with to have a physician or healthcare provider that you work with, or a team of providers. If you haven't before, change your mindset of that relationship. Change it from one of being a participant where you're taking in all of the information and maybe educating yourself, but you're taking information from them, and change that shift your mind to where you are a partner with your healthcare provider and your healthcare team. It's important. Your healthcare provider is the expert, but it's important that you bring to that meeting, that conversation, that visit, that exam, what's been going on with you the other 364 days of the year. So partnership is power tip number one. So first things first, make that appointment. Make your appointment for your annual physical. Make sure that you make yourself a priority. Keep it no matter what. Once you make it, it's non-negotiable that you, within your means, that you just don't feel like going, and so what do you think about? Think about how quickly the last year has gone by. Think about, if I canceled my appointment, another 6 months or a year may go by before I even think about rescheduling. So make that commitment to make that appointment for your annual physical, and no matter what, within your means, keep that appointment. Life is busy, so just make sure that you make that appointment. Another thing, be prepared for the appointment. You have an expert. You have your physician, your healthcare provider, your healthcare team with you. Maximize that time with them. Be prepared. It may be a year since you last visited them. And so do a quick check. Has anything changed? They're going to ask you that. So be prepared. You may have forgotten that, oh, you know what, I threw my back out, or, had something minor to happen, which may be information that they need. So don't assume that they know everything. So just make sure that you are prepared. What has changed? Think about what's changed. What are your personal, this is really important. What questions or concerns do you have especially since your last visit? Has something changed? Again, 364 days, if it's been a year or more since you last visited them, something may have changed. So this is your opportunity to say to your healthcare team, oh yes, this is what's happened since I last visited you. What changes have happened in your history, but also your family history? That's important. They always ask us your family history, and you're like, okay, well, why do they want to know that? Because that's important to my health, is my family history also. So what changes have happened or occurred with your family history? We all may be aware of electronic health records, and they're wonderful. Electronic health records have all that information. As you visit a healthcare system, they put all that information in there, and it goes from visit to visit. So you think to yourself, oh, well, it's in my electronic health record. And so you think, I only have to be so prepared because we can always go to that. But let me tell you, be prepared just for your own, just to have your own, be your own advocate. So be prepared. I know that with me, and I'll share some personal stories throughout our visit today together. I know with me, as I get older, I get more forgetful about what year this procedure was done or what year this surgery was done. It's just, and especially if I'm on the spot and a doctor is asking me, and if I'm thinking, oh, it's in the record, but if they're asking me, they may need to connect some pieces of a puzzle or connect the dots in order to help with what I'm presenting to them now. So I learned a few years ago just not to depend totally on the electronic health record for my own awareness, because I don't want to make the assumption that I don't remember those years. But by me having a place, I'm a hard copy person, and also like to put things on the computer, but I like to have it right there with me. And so that to me is helpful. So whatever works for you, but I'm just going to share some things that have worked for me. So list of your medications. That's in your electronic health record also. But one thing that I noticed is that in the healthcare system where my electronic records are housed. Once I go to that next doctor's visit and they update that list of medications, they just wipe out the previous. And so I had a situation where something came up again and I couldn't remember, well, what did I take? What was prescribed to me before? Couldn't remember it. So it's like, okay, I didn't come equipped to know whether or not what they were prescribing for me this time, because I know the other time it worked and I remembered that whatever it was, it worked, but I didn't come prepared and equipped to know if what they were prescribing was the same thing, number one, and if I had been able to suggest, well, the last time I had this was prescribed, just to have that reconciliation. So again, I'm just a person that the last couple of years, I've wanted to have things written down, just for me. But electronic health records are good. Another thing to think about with electronic health records, I'm a proponent, so don't think that this is a complaint, but just something to consider, is that sometimes if you go to another health system, so say you have one doctor that's in this healthcare system in your city, and then you go to another doctor that's not your primary care provider, but it's one of your physicians, and they're in another healthcare system, you have to want to make sure that those two systems of electronic health records speak to each other. And so that's something that I want to stay on top of in my medical journal, my folder, is so that when I do go back to my primary care provider, I'm like, okay, well, I visited these other physicians and this is what happened and this is the reason why. So again, just whatever works for you, just some suggestions. You have a limited amount of time with this expert, this healthcare professional. Maximize it. Don't just nod and listen, ask questions. Sometimes I get amnesia, just like I do sometimes when I go to the grocery store and I don't have a grocery list. I can't remember what's on that grocery list on my refrigerator. I always forget something. And that something may be what I went to the grocery store for in the first place. So you want to make sure that you have asked questions, but also maybe have a list of concerns. And one of the things that I used to do that I don't do any longer is I used to, like, a couple of weeks or a week before my appointment with my primary care provider, I would think of these questions. I would reflect back on the year. It's like, okay, since I last saw them, okay, this happened and that happened. And I write it down, but it doesn't capture the entire year. So just devote just a notebook or a folder that you have that you can just jot down some things that are a concern. Now, if it's something that's a concern that you need to see a doctor right away, do not avoid that. Do not say, oh, well, I'm going to go see them in 6 months anyway. You prioritize your care. And if you have a feeling that you need to see a physician, then you see a physician. But if it's just things that you just want to run by them, maximize that time with the expert. Because once you leave the office, even if you make a phone call, it may be a little more difficult, more challenging to reach them. And I like the face-to-face or the telehealth, even face-to-face, as we're doing more telehealth now. I just like that conversation of face-to-face with them also. But don't just nod, because sometimes nodding, we do that as we're nervous, but it means agreement, or it means that I understand and don't be afraid to say, I don't understand. Do not be afraid or hesitant to say, I need you to explain that to me. I need you to explain that in words that I understand. So just remember those things, that you have a small amount of time, and it may seem like they're rushed when they're with you, but again, if you come equipped, you can make sure that you ask those questions and get that conversation going with your primary care physician. Before you leave, another thing I had in my notes to remind you. As they're talking to you and giving you instructions, sometimes we might be guilty of, okay, I really don't understand what they said, but I'll Google it later. Be careful. because Dr. Google has all kinds of opinions and people's blogs out there that's not scientific related or evidence-based. So be careful where you get your information. A lot of our healthcare systems, if you go to their websites, then they will have a place where you can go and get more information that are reputable sites. But also things like the CDC, the American Heart Association, those things, those are reputable resources for us. But be careful, because sometimes you can get into that information and then you realize after you read that this is not a scientific website or domain. This is someone's opinion and what they experience. So be careful with that. But going before that, if you have a question that's on your mind, you're in front with the expert, truly be their partner, truly actively communicate with them and say, and be okay. Another one of my experiences is sometimes I don't let them know that I'm a nurse, because I'm there as their patient. I don't want them, and this has been done to me several times. Oh, well, as a nurse, and then they'll just, rush off with a lot of information. I want to understand the full effect of what's going on in that appointment. So I may not reveal to them, if they don't know that I'm a nurse, I may not reveal that to them, because I want them to talk to me with the full information, give me the full information. So I have an opportunity to ask questions. Also, ask, how do I follow up? A lot of times, they'll say, if you get home and you have questions, this is, call the office or whatever, but just ask, how do I follow up? Especially if there's been some major changes or some changes in your care. Before you leave the appointment, say, what's the best way I can follow up? Again, the experts right there, I don't want to have to wait or go through the wrong channel if I have some questions that I need to ask. So just ask, what's the best way? Another thing you can do with power tip number 1 in your partnership is take something with you to write on. Take a notebook. You should already have that if you have notes that you want to, your grocery list with you that you want to discuss with them to make sure you hit all the points. But just have something to write on. I am one, it surprised me within this last year with the coronavirus and all the stressors and the pivoting and the changing. I went to a doctor's appointment and had a conversation and got instructions and couldn't remember much of what they said, because my mind was somewhere. My mind was on the next task that I had to do. So I learned to always have, always write it down, always, or either repeat it back to make sure that I understand, because if my mind goes to somewhere else, I might not have heard or understood completely. And they may say, okay, we need to check her out for some other things. We just had this conversation with her. So you think about, that, or if you can or need to, if you're the type of person where you need to have someone with you, then I know that with the COVID guidelines, sometimes they limit that now to have another person in the room with you. But maybe as we get through this and we go back to our new normal, maybe they will have someone there for you for support, and to also be a second set of ears. And I say this because a lot of times, I say this with respect, because a lot of times with our doctor's appointments, they could bring a lot of anxiety and fear, more so than what we would usually have, just knowing that our health and well-being is right before us. It's also important that even though this is called our annual physical or our annual exam, make sure that you include holistically the emotional, mental, as well as our physical health as part of that partnership. So you discuss any issues that you have with your emotional and your mental health. And then we also holistically don't want to forget a component of holistic health is our spiritual health also. So that was PowerPoint number 1. So PowerPoint number 2, be prepared, stay prepared. So again, I gave you all my disclaimer with the electronic health records before, but I like keeping a medical file. Even though I have information electronically, because I'm registered through an electronic health record, I like having a hard copy. A story of a reason why I have both. I've had both, but just an example of why it's important to have both. I'm the caregiver for my mother, and over the past year, twice, there's been 2 different situations that have happened to where EMS was called, and the first thing they looked to was me as her caregiver needing important information for my mother. When EMS is there and it's your loved one, I'm a nervous wreck. Couldn't remember the password to get into my phone for her electronic health record. Didn't have the information readily available. Didn't remember where I put it. So I like a hard copy. And I learned from those 2 experiences. For another opportunity came where I needed it. I had the hard copies that I carry with me in my purse all the time now. And I was able to give that to EMS, and they were able just to take a quick picture. It was her medications, a quick picture of her medications, but I had her medical history. But I also like to do that for myself, because like I said, the older, the more seasoned I become, the more the dates of different things that have happened in my life become more fuzzy. So just think about that emotional component when it comes to being organized and being prepared. Look at things like your medical history, your previous treatments, your results during and post treatments, vaccinations, immunizations, family history, update that, medications and dosages, a list of your doctors, a list of your healthcare team members, if that's physical therapy, occupational therapy, your pharmacy, how to contact your pharmacy, the names and addresses, the first names and last names of those healthcare team members, and their addresses and phone number. I find myself to where, even though that is located in the electronic health record, every year I have to review it when I go for my appointments. So I want to make sure I have that information. Any medical issues and concerns. If you had where you pulled your back muscle, but it didn't, need to where it's a strain, didn't need any type of major attention, but that may be important for me to know that if it becomes consistent throughout the years. I need to know that, okay, in 2020 was when I first pulled my back. And now here it is 2021, I'm having back issues. So I just want to remember those things. Do you have a living will or an advance directive? Make sure that information is there also. And again, think about holistically, my spiritual preferences and spiritual health, as well as my mental, vision, dental. Look at, for my own purposes, what annual exams do I need? When was my last mammogram? Am I at the age or the opportunity to where I need an annual test? And what is it? And so I want to so just like you make the appointment for the physician, you make the appointment for that exam also. Inventory your medications, a part of being prepared. Power tip number 2, be prepared, stay prepared. Inventory your medications. Note when your refills, the number of refills you have left and the time date, because you don't want to have a time space to where you don't have that medication, because they may not all expire on the same dates or need to be renewed on the same date. So you want that list. You may be able to do that through your electronic health record, but it's also good just to, from time to time, just to look at those bottles of medicine and see who are they prescribed by, and when do they need to be refilled to make sure there's no delay. What are your annual vaccines that you need? Or are there any annual vaccines? Are you approaching the age of where you can now get an additional vaccine? Research if you don't know, or use that time to partner with your physician to say, okay, at what age, or am I approaching the age where I need a shingles vaccine, for example? Find a system that works for you. These are just suggestions again. Handwritten, I'm a spreadsheet queen. Uncomplicated, but I love to have my information in columns. And I like it because I can, arrange it chronologically, add to it, print it off, put it in my purse, and always have it there with me. But find a system that works for you. If it's your cell phone, if it's your electronic health record, then that make sure you have that works for you. Your electronic health record will update. Just make sure that you know that. But again, you want to be prepared and be a partner. So you want to make sure that you know that information and not depend upon just one thing. And educate yourself. Communicate, ask for resources. Again, if you research for yourself, look for those reputable websites and be cautious with that, because you're going to get, you don't want to get people's opinions and something that's not scientific. So be prepared, stay prepared. Power tip number 3, be present. I already gave you all my mindful example. Be present, be mindful, be intentional. Be the best advocate you can for yourself. Ask the questions. Don't feel like your questions are too simplistic. Don't feel like your questions are not important. Don't feel like your questions are not valid. They are. They are valid for you and for what your health and well-being means to you. Ask the question, state the concern. One thing that I do is if I feel like I'm not getting my concerns addressed in any situation with communication, I state it in a different way. If I feel like I have communicated it well and I'm not getting the response that where it puts doubt in my mind if I've communicated it well, then I'll state the question in a different way. I just want to make sure that they feel like I understand and that I want to be understood also. And then put on your analytical hat. Once you're given information, take that situation of your personal well-being and say, okay, I'm gonna put these things together. And I'm gonna try and put these things together. Do I understand? Do I agree? Do I understand? They're the expert, but I also know that if I have that deep instinct in me to where I have a question, I need to ask it. I need to clarify it. I need to make sure that there's a continuation of care once I leave the office. So put your analytical hats on and just say, does that make sense to me? Do all the dots connect? And if not, I need help. I need your professional help, your expertise in helping me make those dots connect. Be present and mindful with your self-care. We all have limited time, limited resources, but what is it that brings you joy? What is it that brings you happiness instead of stress? Your current state of things may limit your vision of well-being, but there's something that you can do to start a shift. What's a personal goal that you have to where it's your personal goal? It's what in your situation right now you want to make that shift. And just take a small step. If it's, for example, sweets, and you're like, I'm going to give up all desserts. Well, realistic. Think about for you, and it may be, especially for a time or a part of a new adopted lifestyle. But what will bring you joy may be that you'll eat less. You'll eat one less dessert this week or two less next week, whatever that means to you. Just don't be so hard on yourself, but just know that you're going to use that energy and that power within yourself to move forward. Work with your healthcare team. And if you need to, find an accountability partner. If that makes you comfortable, find an accountability partner. Coordinate your well-being and your care, your physical, emotional, mental, spiritual, to connect the dots. Coordinate that care. Don't leave any loose ends, or if there are loose ends, then start the search for asking the questions. If the dots don't connect, ask yourself, ask your expert why. When it comes to my health and my well-being, I will be present, I'll be mindful, I'll be intentional because I'm worth it. You will be present, you will be mindful, you will be intentional because you all are worth it. And the last power tip is to be at peace. Be at peace. Push through. Tap into that positive energy, that positive thinking to get through this moment, to get you through the next moment, to get you through this step, the next step, and this day. Partner with your healthcare team to maintain and enhance your well-being, not to raise doubt, not to question their expertise, but to truly be a partner, to have that power within you to be a partner. Appreciate your healthcare heroes. They have the expertise. This is not meant to question them in their expertise. It's to partner with them so that you can have your best well-being self for 2020 and beyond, 2021 and beyond, sorry. Prepare, stay prepared so that you can educate yourself and be aware of your own health status, not to make another exhausting to-do list. Be present, mindful, and intentional so that you can enjoy this moment, this day, and recognize all the wonderful moments you're experiencing now and are going to experience. You all have the power within you to take charge of your health. So that's all that I have for my power tips. And any questions or discussions that you have, I feel wonderful to be here and to share those with you.
Let's see.
I have a question, and you may have answered this, but I really appreciate, and I took some notes about all the things to add in terms of what you carry around with you in case, you should need it. But how often do you change that information? And do you just make your own spreadsheet? It sounded like you did, or are you downloading something?
I make my own spreadsheet. And so just for example, since I am my mother's caregiver, I have her list of medications. And I have like the times of day, I have it on a spreadsheet. And so I have the times of day. I know you probably can't see this, but it's just a real simple, several columns. I have the times of day that she gets those medications. But also what I started doing was and this will apply for myself too. If something were discontinued, then I make a small note like after the list of it was discontinued on this date. And the reason why, because I've had doctors ask me or healthcare providers ask me, well, why was that discontinued? Because they weren't aware that another physician or healthcare provider had discontinued it. So that's been helpful for me in my situation, to have that just a simple, for me, I say spreadsheet, but I just need something the way that my mind thinks, that are columns that gives me a timeline and then a notes column so that I can say, okay, this is what happened. Because my memory is just not going to allow me to remember that that often. How often do I change it? There's no set time. I just know that I visit it whenever there's some type of change, whenever there's some type of, which is often for my mother, but for my personal one, I make sure that I keep up with that. And if I don't have time to do something on the computer, then I have one folder that I'll just write a note and stick it in there. And then I'll go back to it later. So I don't have a set time to answer your question. I don't have a set time frame, but it's just as something happens or something changes, then I make those changes. And then another thing to remember is I've made the mistake before of having too many copies. And so when I got to the doctor's office, I realized I had the previous version. So now what I do is I always put at the top, whether I handwrite it or whether I document it within the spreadsheet, revised on this date. Or if I don't have time, if I'm just writing on it, then I'll put on there the revision date at the top so that I know that this is the latest version. And then it just helps me to organize. And then I limit myself to 3 copies. So I keep one in my purse. I put one in the folder that either, now it goes with me everywhere, but with my mom. And then I keep one, one in my purse, one in my folder, and then one in like a bag that I have, a caregiver bag that I have for her. But I limit because at first I was making several copies, but I had to stop that because it was getting confusing for me. So I hope I answered your question.
You have any other questions?
I saw someone in the chat wrote that do not be hesitant to tell the healthcare provider to speak in terms that you understand. And so do not hesitate to say, I don't understand. And I've gotten that look before, like, the ones who knew I was a nurse and kind of looked at me like, you don't understand that? It's like, no, I need you to hear, I need to hear it, in a different way. Someone said that they enter their prescriptions into their notes in their cell phone, and they also take prescriptions of their label, and that's helped them. That's a great, great opportunity to have that. Someone said that they ditched their physical appointment for a work meeting this week. Treat yourself. Take a vacation day, if you can, on your physical, your annual physical. That way, that just minimizes, if you can, that minimizes anything coming up to where you can't make it, and just takes that out of the equation. I used to have to do that. One of my physicians years ago, loved her to death, but she was so thorough, and you were in that annual physical for hours. So I got in the habit of taking vacation days on the day of my annual physical, but she was very thorough, remembered everything.
I see, Michelle, there was a question of, does it cost anything to get your medical records from your doctors? Can you just request those?
You can request those. Find out from your physician or your healthcare system that you're with to see how you can do that. Usually, even if you, so for example, even if you work for a healthcare system, you still want to make sure that you cover yourself, that you don't just access, that you sign some type of waiver or request to access your medical records. That's if you work within the healthcare system where you can access all records. But yes, find out, just ask your physician, start with them or their healthcare system, how you can request that information. That's to my knowledge. And if it's different, I apologize if it's different for the healthcare system that you're in. The one that I'm used to working with, you can request it.
Hi, Michelle.
Hi.
Hey, I had a question. How often should you have your doctor do like blood work panels on you? Is it like just once a year or when needed? I know I've gone recently, since I have a primary care physician now. She's pretty thorough, so she did that for me. But before that, I really didn't have that done. So how often should we have blood panel workups done?
Okay, so I am not able to give medical advice, so my
Okay.
apologies for that, but definitely have that conversation with your healthcare provider.
Okay.
And also, when you have that conversation, ask what things made them come to that decision. You know, is it because of your age? Is it because of other factors? It doesn't hurt to ask, well, if you're telling me it needs to be this period of time, then, just empower yourself to say, well, connect those dots again. Well, what made you come up with that period of time? Because you're educating yourself. So my apologies, Kathy, I don't want to give out any medical advice, and it's different for different people. So, it's just what you bring to your physical, what your physical requirements are based upon you as an individual and your well-being.
Okay.
But yeah, just work with your primary care provider and ask, and then go the step beyond and ask, why did they come up with that time frame, or how did they come up with that time frame?
Okay, thank you.
You're welcome.
Okay, I don't see where we have any other questions.
Well, can I say again, thank you all. I really hope that I have a passion for wellness and well-being and health. And I just hope that I was able to share something that, was a moment that you could take advantage of or think in a different way or not. I'm hoping that the presentation provided something for you to where you can look at how can you coordinate your care, because that to me is so important for our well-being.
Yes. Well, thank you so very much, Michelle. You've given us some great information to think about. And again, as we move into 2021, to put us on a great path. So we appreciate you joining us today. And if anyone still has any questions later, or feel free to just reach out to us. We're going to put our contact information in the chat box. So feel free to reach out to us. And if there is something that you wanted to ask Michelle and didn't think of it at this moment, send it to us in our email, and we will certainly forward that to Michelle and get back with you. But again, thanks so much for joining us today. And we just will hope to see you guys soon. Again, our doors are still open, and so we hope you will stop by and see us and enjoy the rest of your day.